What steps would you recommend that these individuals take to open up their own dry eye specialty clinic?
I think first, it's so important to identify the quantity of patients who need your help from an OSD or a dry eye standpoint. And the reason I say that, this is now my business owner mind and my revenue generating mind that comes into this
Sure.
conversation, because you really need to understand, if you can identify, just go into your EMR and figure out how many patients in the past 3 months have I diagnosed with this one ICD-10 code, or how many patients have started treatment for this one ICD-10 code, and take that as a percentage. That's number one. Number two, I think, is really evaluating or reevaluating, how are you even diagnosing dry eye? What equipment do you have to diagnose dry eye? Now, when I first started, I would say slit lamp, your fluorescein, lissamine green, vital dye staining, questionnaires. Those are absolute minimal basics. I would add to that early on mybography. It's really important to have mybography. And my experience has taught me with a specialty dry eye practice, whether it was retina, whether it was my own, because we had mybography at the retina practice as well, is that patients need to see, right? The picture is worth 1,000 words, and patients really need to see the problem, because sometimes they don't feel it. Sometimes it can be an asymptomatic
Hmm.
disease. So
Yeah.
understanding what diagnostic equipment you have, and then what can you obtain. And nowadays, I mean, like you said, when we graduated, there wasn't a lot in terms of diagnosing dry eye. Like, you would just need your fluorescent green slit lamp, symptoms, and you would treat based off of symptoms. I know so many doctors now who don't treat unless the patient has symptoms. But where does that leave our NK patients where they don't have any symptoms? Where are we doing them a disservice if we're not even treating? Even Demodex blepharitis, not every patient is going to have symptoms with Demodex. Does that mean that we don't treat it? Or does that mean we should take a picture and show the patient and get them on treatment? And now we have treatment for it because we know that it can cause complications. So understanding your diagnostic need is very important. And then understanding, what is your protocol? So I'm diagnosing the patient. Is that going to be under the vision plan? Do I bring them back for medical? How do I charge the medical? What medical insurance am I on? Again, this is my business owner mind, right? How am I going
Oh,
to get
yeah.
paid for this? Right. And notice those are the first three steps. I didn't talk about IPL, right? Because I don't believe that you need to have an IPL right from the get go to have a successful dry eye clinic. I think if you're identifying the need, diagnosing appropriately, and then educating your patients with mybography, for example, and you have some sort of protocol in place, some of these other fancy tools, you will naturally evolve into needing those tools, because now you've exhausted the resources that you have available, the therapeutics and the punctal plugs and whatnot through medical insurance. And now, naturally, as a fourth step, you'll be looking for, well, what should I bring in next? And I do think that a lot of doctors are under the impression that they need to have some special fancy tool or equipment like IPL to start a dry eye clinic. And then I hear from a lot of doctors that they get frustrated because now I'm not generating enough income, or I thought maybe I was going to generate more income than I am, and I feel hopeless with this machine. There's a lot of steps before you acquire this fancy equipment.